I never imagined that I would be a part of a statistic to be mistreated when going to the hospital to give birth. I just remember, oh my God, like, I'm gonna die. I was released from the hospital, and then the next day I was taking my daughter to her pediatrician. We went into the elevator, and the whole time I'm just thinking like something's not right. I immediately felt something, felt like it popped. It was so painful. It felt like anything that touched my skin, I was gonna burst from the inside.
I remember one incident, the nurse was doing a fundal check, and I told her, I'm like, this is painful, it hurts. She said, this is how we do it, and you have to bear it down. And I don't think that's the most appropriate way. It's what we say matters just as much as how we say it. I think it's important for nurses, as well as other members of healthcare team, to listen to the voices of patients and feelings be validated.
We all have this innate feeling that, yes, that exists, but I'm not a racist person. I don't treat other people that way.
We don't necessarily know that we have implicit bias. Implicit bias are stereotype perceptions that we have about things or people. It's things that we learn from our upbringing, but we all have an opportunity to change in the environments that create spaces where implicit bias is accepted.
I remember like screaming to the nurses and doctors that I was in so much pain, like I need help, something's going on, something's not right. And it just felt like they just didn't care. I was at that hospital for about 12 hours and they still hadn't found out what was going on. The nurse that I had, she kept trying to like make me do things that I literally couldn't do. I wonder if she feels like I'm just being dramatic. When you're looked at a certain way, it feels like you get a certain treatment.
The main challenge that we face in society is structural racism. Implicit bias is one of the branches that comes off of it. All play an active role, and it has to be care that validates the voice of a patient.
We really need to be so much better at paying attention to our patients. If we're not called out on it or we're not told about it, we'll never know. We'll never be able to change.
I remember being taken up to my room, and my former student was on that unit. She said, I told the other nurses on the unit that you are my program director. You're excellent, you're great. And I was like, oh, that's wonderful. It wasn't until that I felt as though the treatment that I received in the hospital was different. People thought we mattered, where prior to that, I didn't have that feeling that we mattered, which is problematic because I don't think it should matter what your educational status or your socioeconomic status is to receive proper care and attention.
I had never been through something so traumatic in my life. Being young and even wanting to have children in the future, this is something that literally makes me think not just twice, but 10 times before I even think to conceive again.
I had a desire to have more children, but based on that experience, I had a delayed process, bonded with my son in the hospital. I have reservations, and so does my husband, about planning another pregnancy anytime soon, just because of the experience we had during our first pregnancy. Hospital systems and healthcare systems have to make ongoing continuing education regarding implicit bias as mandatory, training staff members on a regular basis. It can't be something that's a one and done. It has to be something that's embedded and truly integrated within a specific hospital system or healthcare system. And it shouldn't be a shameful topic because it's something that we all have and that we learn over time. And the beauty of it is that because we learn it, we can unlearn it. It takes true commitment to self-reflect and to make necessary changes to help mitigate those biases. Engaging with diverse populations of people on a regular basis. You learn about the population and helps you better care for those populations of people. That can change the life of a child growing up without a mother.